Hello, I am Dr. Mark Ryder. I am a licensed psychologist and developer of the revisioning techniques for grief and trauma. Here at the Revisioning Center for Grief and Trauma, we have discovered that these conditions are the emotional equivalent to phantom limb pain in amputees and stroke victims. Revisioning rapidly eliminates symptoms without having to relive the loss or trauma. Revisioning is a therapist-guided technique which restores lost identity and joy following prolonged grief. In treating PTSD, this technique reconnects individuals to pre-trauma happiness and safety. What do complicated grief, PTSD, and phantom limb pain all have in common? Neuroplasticity, or changes in brain activity following the loss or trauma. 80% of amputees and stroke victims experience phantom limb pain. But this pain doesn't originate in the limb, it comes from the brain. This is the sensory motor cortex here in the red and blue. The hand and lower arm are located about here. Let's say, for example, that the arm was amputated at the elbow. The anatomical location of the hand then shrinks. The cortical neighbors on either side of where the hand was located are the shoulder up here and the face down here. The shoulder and facial positions then encroach on the available real estate. This neuroplasticity causes two things. The missing hand can now be felt by the person on the shoulder and the face. And secondly, pain is experienced as the inability to move the hand out of its seemingly permanent and uncomfortable position. The amazingly simple answer to curing phantom limb pain comes in the form of mirror therapy. This is the mirror box here. The amputee's stump is placed in the mirror box so that the mirror is facing the intact hand. The mirror image gives the illusion that the intact hand is now the missing hand. When the client is asked to move the fingers of the intact hand, the client not only feels sensations in the amputated hand, but can now activate the motor memory to move the affected hand out of its painful position. Furthermore, when fMRIs were done after mirror therapy, the neuroplasticity had reversed and the cortical location of the affected hand had re-enlarged. In complicated grief and PTSD, neuroplasticity also occurs in the same way. Memories of our loved ones are imprinted within our mirror neuron network, also located in our motor and premotor brain regions. The mirror neuron network is responsible for imitation, empathy, and imagination. Relationships involve imitation of each other, empathizing with our loved ones, and imagining our lives together. Research has revealed that our loved ones actually occupy space within our own brains. When we have lost a loved one, this cortical imprint again shrinks due to neuroplasticity, causing emotional pain. In persistent complex bereavement disorder, clients experience what I call phantom person pain. Their own identity becomes lost and they long for the return of the departed. Again, with the help of a mirror, photos, and an empathic therapist, this lost identity can be rapidly restored and the sadness and bitterness alleviated. This new therapy is called revisioning. 95% of over 1,000 clients treated by multiple therapists have eliminated the debilitating symptoms of complicated grief in just 1 to 2 sessions. Revisioning is one of the first brain-based therapies which works through proven activation of the mirror neuron network. And now, revisioning can help to rapidly reduce the symptoms of PTSD. Unresolved grief and trauma are the underlying causes of most depression, anxiety, and addictions, so these disorders can also be successfully treated. Please visit us at revisioningsenterforgriefandtrauma.com for more information about treatment. We also offer a certification program for licensed therapists. Thank you very much.